Today we are here because we are going to disseminate 2 study findings that we've conducted within the BMI's Living Labs. Living Labs are open, innovative labs where we work with communities to come up with solutions to address their own issues.
It is important to involve the community because these are the people who are affected. So now when we get feedback, when we get data from the very owner, then that means we have the right information.
We had started a project, Living Lab project in Kaloleni, Rabai. This was to look at the baseline characteristics of NCDs and mental health within the population, and we had started with training the community health promoters.
We had 3 main objectives. For the young population, we are looking at the prevalence of depression, anxiety, suicidal behavior, and we're also interested in protective factors or factors that boost their resilience. And for the elderly population, we are also interested in common mental health problems, but we're also interested in their physical health as it's highly linked with poor mental health outcomes.
We did find findings that were positive findings and negative findings, and this is where, which will allow us to build in interventions for the next studies that we want to do, which will tailor with specific population, and understand and bring in interventions that we could work with the community.
BMI started engaging THP as an introduction to this particular study. Then from there, we organized trainings. We refined the data collection tools. We redid the training again just to make sure all parameters are okay. The next bit was to pilot the tools. We also had role plays during the training. Apart from role plays, we now went to the community to test if it would bring in the right information.
I conducted a research among young people between the age of 16 to 24, basically to look at ways of advancing digital mental health for the youth. So with a sample from the Kenyan coast in Kilifi and Mombasa counties. So in terms of qualitative data, what we found from focus group discussion with these young people, most of them considered it acceptable to use digital devices for delivery of mental health interventions. And some of the key challenges that were mentioned by these young people include high cost of data, but also rural problems like issues to do with electricity, shortage of places to purchase these digital devices, among other reasons.
We normally work with the CHPs, especially in this program. We'll be able to say that the CHPs were trained on data collection. At first, people were thinking it's going to be so hard, but it became so much easier because the community have a very good accepting these people and saying, oh, this is our program.
We say thank you for the collaboration. We are a bit well covered with the part of the mental capacity on the side of the Brain and Mind Institute. And as a community, we say we are very much humbled for that service. For this program to come, we appreciate that many people will come up, will appreciate and be ready to be treated.
We are eager to welcome our partner back, Aga Khan University, BMI, because they have really helped our community. And I know by welcoming them back, they will bring more projects. They should come more because we've seen the impact on the ground from the Aga Khan University, BMI.